Mr Limbrick.
Thank you, Acting President. Protecting privacy is key to ensuring human dignity, safety and self-determination. It's a fundamental human right that underpins freedom of association, thought and expression, as well as freedom from discrimination. At least that's what it says on the website of the Office of the Victorian Information Commissioner. Both the previous and the current federal governments have acknowledged how important it is to get the laws and regulations around privacy right, with the Federal Attorney General releasing the Privacy Act Review report just last month. Running at over 300 pages, the report concludes years of work to update our national privacy framework, which has been widely criticised for being woefully out of date. Some highlights that are relevant to the discussion today include Proposal 11.1, amend the definition of consent to provide that it must be voluntary, informed, current, specific and unambiguous. Proposal 11.2, that the Office of the Australian Information Commissioner should develop guidance on consent requests. Proposal 11.3, expressly recognise the ability to withdraw consent. Section 4.7 relates to sensitive information, noting that sensitive information may only be collected with consent unless an exception applies and more stringent requirements apply to its use or disclosure. This includes health information. Now, we have a situation now where the Greens have apparently done a deal with the government to look at privacy, which takes into account none of these issues around consent. There is no ability for someone to withdraw their consent, to give consent or opt out of the system. They're just talking about security, basically. And consent is a key feature of this report into privacy frameworks. And what we're doing here today is we've got a bill that ignores consent of the patient. The report also recommends reforms focused on more control for individuals over their personal information, with a number of proposals modelled on the European Union's General Data Protection Regulation, called the GDPR, which I'll come back to later, as they interact with exactly the kind of digital health sharing systems that we're discussing today. And it's hard to think of any information any of us might have that is more private than our medical information. In this case, sharing is absolutely not caring. And I'm not here for a second to endorse the old ways of handling medical information, like through fax machines. Clearly it needs to be updated. This need was identified in another report published in December. The Strengthening Medicare Task Force report clearly identifies an urgent need to improve IT infrastructure, modernise the My Health record system, better connect health data across all parts of the health system and to make other improvements. Absolutely no one I'm aware of continues to argue that the clunky system does not need updating. The debate here is about consent. But this is pretty much the opposite of the proposal before us today. Under this proposal, a range of people working for health services, not just doctors, but many people working throughout Victoria's health system, will be able to find all the private information you provided over the last 3 years. You don't have access to it, you have no choices at all. Your information doesn't belong to you. It's hidden from view, collected and shared without your knowledge, consent or participation. Here it will be kept safely in a handy database where it will supposedly be kept safely and secure. Australian governments have a shocking record when it comes to managing IT projects. The federal government's COVID Safe app is probably the most famous example, but the Victorian government is every bit as inept, having overseen Find Victoria's new IT system that incinerated $60 million of money. No doubt some of the people involved in these projects will be put in charge of handling this information. If not, maybe they'll get them from Optus or Medibank. It's worth noting that the first targets of the Medibank hack were high-profile figures threatened with the release of their sensitive health information related to mental health and substance abuse, exactly the kind of information that could be scooped up and widely accessed under the information scheme proposed by the government. While I'm sure all efforts will be made to ensure that the database is secure, people who have concerns, and there's probably more of them now than there were a few years ago, have very good reason to be concerned. Some examples of where data breaches have resulted in the exposure of sensitive health information include, in 2019, New Zealand primary health organisation Tuora Compass Health disclosed a data breach that exposed medical information of roughly 1 million people. In Norway in 2018, Health South East Regional Health Authority experienced a data breach where personal information and health records of 2.9 million people, over half the population, were stolen. In 2019, Canadian clinical laboratory service Life Labs experienced a hack that exposed the records of up to 15 million patients, including 85,000 lab results. They chose to pay the hackers to return the data. In Sweden in 2019, 2.7 million call recordings to a health service line were exposed after being uploaded to an unsecure server. In the USA, in 2022, the Department of Health and Human Services listed 701 major data health breaches affecting 59 million individuals. Global risk management firm Kroll has reported that healthcare has overtaken finance as the most breached global industry in 2022. I could go on at length as there's so many examples, but the point I'm trying to make here is that the proposed centralisation of our health records in this database will be one of the most valuable cybersecurity targets in the nation. Shouldn't we have the option of whether we want our information included? Shouldn't we have the option, even if we want to participate in the scheme, to choose to keep our most sensitive information private? Of course, the government will assure you that your information will be kept safe. But tell that to the Victorian Information Commissioner. They reported 124 data breaches in their most recent annual report. This new database would become a honeypot for organised crime, international intelligence, or even marketers. In particular, I'm concerned about the dangers for women. It's not hard to imagine that a jilted lover you met on Tinder or a stalker who works in a hospital could get a hold of your information and send it. All it takes is one breach for this information to be all over the internet, and the internet's forever. The risks are real, and they don't just come from external threats. The Cybersecurity Coordination Centre in the USA Department of Health and Human Services published a report in 2022 on insider threats in healthcare. They noted a decrease in external threats had also corresponded with an increase in internal threats. These came from a mix of malicious insiders and negligent ones, with negligent insiders making up 61% of insider threat incidents. In the latest data breach report from the Office of the Australian Information Commissioner, health services remain the sector with the highest number of notifiable data breaches. For the purpose of our debate today, it's worth highlighting that it was easily the sector with the highest number of data breaches caused by human error. It's a cliche in cybersecurity, but it's true. The people are the weakness. It's not that they're bad or lazy, but we know that people are more susceptible to cyber attacks, such as phishing emails, when they're tired and overworked. And we know that healthcare workers can be among the most overworked people in the state. My concerns about the structure and security of the system are not really a good reason to oppose the legislation, however. It's clear that we do need to speed up the integration of digital records into the health scheme. The central question here is simply, who owns your private medical records? Do you have any rights to view and control your own medical records? Are other people, agencies, services and businesses authorised to have control and streamline access to your records while they're hidden from you? We've had this debate before. The debate around the federal My Health Records scheme covered much of the same issues. The sensitivity of certain records relating to sexual health, substance dependence, mental health issues. But even worse, the legislation needed to be amended because it left an open door to other agencies such as the ATO, Centrelink and police to access these records without a court order. At the time, the head of the Royal Australian College of General Practitioners revealed that he opted out over concerns that these other agencies would have access to his records. Parliament had to come back and fix it, and while about 10% of Australians had opted out, the design is much more ethical and patient-centred than what is being proposed today. The system also allows you to view your own records, check them and choose what may be viewed. Unless it is amended, this bill will give you no such luxury. There is currently no opt-out or opt-in mechanism and no independent oversight. This is a flagrant breach of every written principle of healthcare. Right up to the report of patient-centred healthcare that you'll find in Australia's Charter of Healthcare Rights, launched in 2019. According to this charter, patient-centred healthcare is about treating a person receiving healthcare with dignity and respect and involving them in all decisions about their health. This government has a different view. The new law means information collected from you will be exempt from critical parts of the Health Records Act and these pesky health privacy principles. It's also arguably another breach of Section 13 of Victoria's Charter of Human Rights and Responsibilities, the right to privacy and reputation. As the website of the Victorian Equal Opportunity and Human Rights Commission states, this right applies to surveillance such as closed-circuit television, collection of personal information by public authorities, results of medical tests or examinations and other confidential matters, end quote. What a strange debate we're having over this legislation, as though the idea that patients should be centrally involved in decisions about their health is some radical and outlandish prospect. No doubt in the next couple of weeks we'll hear about some new announcement what the government is doing to implement the recommendations of the Royal Commission into mental health. Maybe we should talk about recommendation 62, where it says, and I quote, "A new user-friendly online consumer portal for web and mobile connected to the mental health information and data exchange that allows consumers to view key information about themselves and authorise, or not authorise, sharing of information with members of their care team, including families, carers and supporters," end quote. It's hard to understand why we have these very sensible recommendations that the government has committed to implementing, and then we have the bill before us today. Do ministers in this government even talk to each other? Does this mean that we'll have parallel systems for mental health data? One where service users have access and the ability to authorise sharing, and another one where their information is scooped up and shared without their consent. It's not a radical idea to centre patient rights and consent when it comes to electronic medical records and data sharing. The Law Institute of Victoria has publicly expressed their concerns with the legislation, as has Liberty Victoria. The Victorian Alcohol and Drug Association have expressed concerns, noting that people with drug and alcohol issues were the very first people targeted in the Medibank leak. The Health Issues Centre, the Australian Privacy Foundation and Digital Rights Watch have all echoed similar concerns. So how do other jurisdictions handle this? The government would like us to believe that this is simply standard operating procedure and not some sinister violation of our medical privacy. The balance between privacy and convenience is one that any country with digital health infrastructure will have considered in recent history or may be in the process of considering at the moment. Let's start with the European Union, returning back to the GDPR that I mentioned earlier. The GDPR explicitly provides for a right to access your own personal data and approve its transfer to another entity and have it transferred directly to you. You have the right to request rectification of your data and have a right to erasure and several rights ensuring consent around medical data. In the UK, a 2013 plan to centralise GP records in a database was abandoned in 2016 after confidentiality complaints, and more recently the Department of Health had to concede that they had taken the trust of the public for granted in relation to a medical data sharing scheme that was badly rolled out in 2021. They've since committed to ensuring better engagement with the public, improving individuals' access to their own health records and simplifying opt-out processes. In Ontario, in Canada, health privacy is governed by the Personal Health Information Protection Act. This gives the right to refuse or give consent to the collection, use or disclosure of your personal health information, except in certain circumstances. It gives you the ability to withdraw your consent by providing notice, expressly instruct that your personal health information not be used or disclosed for healthcare purposes without your consent, access a copy of your personal health information except in limited circumstances, and request corrections to be made. Even Thailand has been undergoing this same process of centralising health records and streamlining data sharing. Data privacy in Thailand is governed by the Personal Data Protection Act. Many elements of this legislation are similar to the EU GDPR, with individual privacy rights central to its function. Consent, particularly in relation to sensitive data, which includes health data, is central to its function, with guidelines for obtaining consent from data subjects published late last year. These require that consent be freely given, that it be informed, specific and be able to be withdrawn, totally unlike this bill or the proposed amendments. So here in Victoria we are clearly laggards, not both in technology but also medical ethics. Why not look at the country that ranks as a leader in digital health, or I should probably say the leader on every measure that is ranked? Estonia, a country that's globally recognised for their innovation when it comes to creating a digital economy and integrating this with government services. They were early movers in digital health, regularly reviewing and updating legislation and processes. 99% of health data created in Estonia since 2015 is fully digitised. 97% of hospital discharge letters are sent electronically to the central database. 99% of prescriptions are electronic, and nearly every hospital and pharmacy is on the network. In stark contrast to the approach proposed in the legislation before us today, patient rights are absolutely central in this scheme. By logging into the patient portal, you can view your health data, provide additional information and update records. If you wish, you can close the... There might be a good point there. If you wish, you can close the data, removing it from view, even if this would negatively impact your healthcare, because it's their choice. You can make various declarations authorising or refusing certain procedures, authorising persons to purchase medicine on your behalf, consenting to organ donation, or otherwise consenting or withdrawing your consent for medical care, or what happens to your medical data. I could go on at length describing the various approaches that different countries have taken to this issue and to navigate the tensions between data security, efficiency and patient autonomy, but I'll simply conclude by stating that the staff of my office have spent many hours poring over different health department websites, journals and medical technology press from around the world, and they've struggled to find another example where an electronic health record system exists that doesn't allow for patient access and allow for either an opt-in or opt-out provision. What is being proposed here is completely out of step with best practice, with human rights, with international best practice and with the Australian Charter of Healthcare Rights. We saw this throughout the pandemic. Under a state of emergency, government ministers and health bureaucrats determined that they knew what was best for us and any dissent was irresponsible. They know best and our preferences be damned. Frankly, I'm sick to death of our basic rights being trampled with some hand-waving justification. Our rights aren't just an inconvenience for the government and bureaucrats to be disposed with as soon as it becomes difficult. It's not good enough. The idea that this is the only legislation that could achieve the intended outcome and there is no alternative, less restrictive approach that could be adopted is a farce. It makes an absolute mockery of our Human Rights Charter that creates a legal obligation for Parliament and the public service to act in accordance with the Charter, including considering less restrictive approaches. An e-petition calling on this chamber to consider amending this legislation took only a few days to collect over 10,000 signatures. People in this state are clearly concerned about their medical privacy. While I can't speak for the reasons that each of these people signed for, the simple fact is that it doesn't matter. It doesn't matter if their reasons are based on misunderstandings or if they are so profound that they'll make you cry. It doesn't matter. All we need to know is that they want to have control over their own sensitive medical information. This should be enough. And I would like to signal to the House that I have two amendments that I would like to circulate now that address some of these issues. Can I continue speaking?
Yes, continue, Mr. Limbrick.
The first of these amendments addresses the issue around consent. It ensures that patients are not brought into this system without their consent, in line with the Charter of Healthcare Rights. It also ensures that people can select certain pieces of information if they want certain healthcare providers to be included or not included. It also caters to provisions around consent for children, where consent is a much more complicated issue. The second amendment deals with ability to access audit logs and these sort of things. I note that the amendments, the House amendments that were only circulated a while ago from the government also address this issue. So at least one thing that I'm concerned about might be addressed, but I think it's absolutely essential that people know who has accessed this system, who has accessed their records, and what information is actually being held in the system. Also, I would like to signal that these amendments that were circulated, only a few minutes ago, have not been viewed by any of these organisations that express concern. They haven't been looked at by SARC. There's very serious human rights implications with this bill and the proposed amendments. I will be moving after second reading that this bill goes back to SARC for reassessment, including the amendments, so that we can get a better understanding of the human rights implications of what's being proposed here. And with that, I will conclude. Thank you.
Thank you, Mr. Limbrick.